Hey, welcome back to episode 4.
Hello.
So last time on Tuesday, we released a video about Donna Mac's lovely prehab workout. In that workout, Donna, can you explain what we were doing?
So we were working on increasing my muscle strength around the knee joint, so my recovery will be better. So.
And it's very important that when someone goes into surgery, that you have as much muscle in the bank as possible, because after the surgery, you're gonna have to spend some of that, so to speak, in order to stay healthy. I have a question for you. So during your prehab workout, there was a few moments in there that you were really pushing it. Did you have joint pain when you were really getting pushed during that workout?
I did not have any joint pain. I felt my quad burning to where I couldn't do it anymore, but there was absolutely no knee pain.
A lot of people, I would assume, stay away from prehab or working out because of joint pain because they're afraid of the pain.
Right.
But you're able to escape it during your workout routine, right?
Yes. I don't do anything that actually causes me pain in my workouts, which sounds strange, but it's true. Most of my pain just comes from walking or hiking or going up steps. So the exercise is actually really good.
Talk a little bit about how we work around your pain issue and your arthritis.
Yes. Well, we don't do anything that causes pain, like deep squats causes pain. Certain lunges cause pain, but certain lunges don't cause pain. Like side lunging is good, reverse lunge is good, but other types of lunges I can't do, so we just don't do them. And I can't do a lot of side-to-side motions because that does hurt. It's been kicking my butt, so I'm enjoying it.
And you'll see in the video, we go through this whole process of there's lots of moves that are classic therapy moves, but we've concocted ways to make them much harder.
Yes.
Correct?
Yes.
So you'll see.
Because I'm working till fatigue. Like my muscles they're working to fatigue, and part of that's because I'm wearing the bands around my leg, which Jason will talk about in a second. But that kind of cuts off the circulation a little bit, so your muscles really are working really hard.
Yes,
so,
absolutely.
Yeah.
Now, and to be clear, I'm going to bring out the bands here. So Donna wore these lovely straps on her leg. So this is a blood flow restriction training cuff by the company Be Strong. And when she puts this on her leg, and I want to be really clear about this, when you see Donna working out in that previous video, this cuff makes everything 50, 60, 80% more difficult. Because it's like her leg is doing altitude training. Because athletes love to go, Olympic athletes and such, they love to go up into the mountains where there's less oxygen to train, and that makes it so much more difficult on their bodies. They do that for the cellular benefit. So when Donna has these cuffs on, she doesn't have as much oxygen delivery to the muscles, so they're screaming.
They are screaming.
They're burning.
They are.
But she's doing that so she doesn't have to lift with as heavy of weights. Thus, she spares her tender joint.
Yes. So I would highly recommend doing prehab before your actual surgery because it's going to help with your recovery. Because the stronger you are, the quicker you will recover. And also, there is some research back that it might help prevent any blood clots that might happen, which is sometimes common after surgery. It improves your balance. You want to get yourself as pretty much as buffed up as you can, so recovery isn't too horrible.
You know, build up the bank account.
That's right.
Build up the bank account. Would you say that in the past 2 to 3 weeks that you've actually gotten stronger?
I do feel like I've gotten stronger, and actually the pain's not been as bad, so I think it's...
Yeah, I was going to ask you about that. So your pain's actually gone down too?
It has gone down.
Yeah, and that's the protective element of muscle. And, you know, although what is done is done, but if people get to just the stage of mild arthritis, they can often come out of the state entirely of arthritis through correct strength training and progression. It's not a death sentence. Cartilage can regenerate as long as it doesn't go past a certain boundary.
Exactly. And as well as your legs, me being in the OT field, you also want to build up your arms. I do this on my own at the gym, but because when you have a knee replacement, your leg is not, it's a lot harder to stand up. So you need to not just build up your legs, but your core and your arms, so your recovery is faster. So you need a strong core to do everything, pretty much. So I do a lot of, I do a lot of different things, but I plank almost every day. I side plank every day. I push the sled, which works your core. I do a lot of floor exercises, specifically addressing my core. And I probably work out my core like 3 to 4 times a week. The most challenging part so far, and this is one of my issues, is I don't have my balance. It's not poor balance, but it's not perfect.
Yeah, that's tough.
Yeah.
Because whenever there's inflammation in a joint, balance centers get shut down. It becomes so difficult.
Yeah. So I'm struggling with that a little bit, but it's going good. I'm getting ready.
Yeah, so thank you for tuning into this episode. Next week, we're going to talk about nutrition, and we will see you on the next episode.
All right. Bye.
Bye for now.